Please, a warm welcome for Michelle. Michelle?
Hi, everyone. Sounds like we have a super relevant topic for today based on this morning's discussions. I'm Michelle Lenzo. I'm joined here by my team. If you would stand up, we have Patty Boyle, our CMO. Hi, Patty. And Elle Whitehead, our Product Marketing Director. All right. So today I'm going to talk about the only ID list behavioral targeting technology for healthcare that leverages both search and claims data called custom patient targeting. I'm going to talk about how we build our models, what data goes into it. I'll share an example, and lastly, a few case studies. Before I do that, I want to take a step back to share more about Dstillery for those of you who are not familiar. So Dstillery, we're a custom audience solutions provider. We sit in the programmatic space. Think of us as a third-party data provider. We've been around since 2008, and we're really backed by data science with over 20 patents, one of which, our map of the internet, is the backbone of our custom patient targeting solution, and others dedicated to fraud and hygiene control. So we're best known for our ID-based audiences. Back in 2017, we decoupled our audiences, really becoming DSP agnostic, making all of our ID-based audiences available across any DSP or social network. So in preparation for cookie deprecation, we built out our ID-free targeting solution. And as you can see here, we've been testing it for the last few years across other verticals outside of healthcare. And through that testing, we realized just how privacy-centric this ID-free solution was and how applicable it was to healthcare. But it was really important for us to have some sort of health signal within the data, within the model. So we went out and vetted all of the RWD partners and decided to partner with Purple Lab, leveraging their claims data. And I'll talk about that in a second. So we built our ID-free solution. So we had a privacy-safe option to continue to efficiently target now and into the future. So in 2023, over half the ad impressions were tied to an ID. As we move into the second half of 2024, that will not be the case. So what's the problem that we're trying to solve? Helping healthcare advertisers who struggle with compliance and are looking for a way to reduce waste and regulatory risk. Custom patient targeting is part of Dstillery's suite of identity-free targeting solutions. Our proven product is a privacy-safe patient targeting solutions that helps healthcare brands drive optimal patient outcomes with less waste. We also have an HCP application that I'll touch on as well. So the three things we want you to remember about custom patient targeting is it's precise, it's custom, and it's compliant. It's precise because our product allows you to target only the anonymous patients that are most likely to convert for your brand. And we do this with our patented AI technology. It's custom because our product takes your desired seed data set, combines it with our technology, and creates a custom model. We view every single campaign as a new custom model, and each model is tailored specifically to the condition and those individual patient outcome goals. Lastly, it's compliant because our product doesn't rely on any form of user-based targeting. We can ensure 100% compliance with all laws, policies, and guidelines. So I'm going to talk about how we build the model. There's two parts to the model. The first one is leveraging claims data from Purple Lab, sourced from Purple Lab. So we use Purple Lab's ICD-10 codes specific to the condition that you're trying to reach. We leverage over 40 billion pieces of claims data that touches over 330 million patient lives, and that represents 98% of payer data, which provides industry-leading patient data that drives both quality and quantity to every single model. So in this example here, we identified ICD-10 codes that were indicative of those patients with overactive bladder. The second part of the model is leveraging search signals. So we heard that this is how people are self-diagnosing online by searching. So sounds like it's a pretty strong seed set to the model. We use anonymous patient and opt-in panel of over 2 million panelists to gather valuable search data. This panel allows us to see how patients search for symptoms, drug names, comorbidities, and more across a variety of search engines. We find that this search data is highly predictive in reaching the right search intending patients. We've heard a lot about patient journey today. The search data really allows us to segment our audience to really identify where that patient is within their journey. Are they pre-diagnosis? Are they looking for a new RX? Are they searching for competitive treatments? Are they caregivers? This really allows us to define that specific audience. So oftentimes we'll work with our agency partners to identify search keywords that have historically performed on their search campaigns so we have the strongest signal possible within these models. We do the same for the ICD-10 codes to leverage the ones that are being measured with the campaign if they're measuring audience quality. So the last step is combining these two data sets. So we combine the search keywords, the ICD-10 codes together, and what we do is we extract 3 privacy-safe signals from that data: geolocation, URL, and time of day. So we're really looking at what is the best inventory, the best moment to decision on an impression at the time of bid. So historically, we've thought about audiences as a bucket of cookies, and in this case, we're looking at what is that best moment. So I mentioned earlier a map of the internet, so we're leveraging our map of the internet, our patented technology, to really scale out that audience to find the best moment that's relevant to that patient population. So the output of that audience is either through our trade desk integration via custom bidding algorithm or a PMP that can be activated across any DSP. So you're interacting with Dstillery when we're curating that audience, but as far as activation goes, everything runs through the DSP of your choice, making it super easy to activate. We can also activate across all formats, so really driving that unified audience strategy across all formats. What is that correct moment to reach that impression across all of these different formats? So display, online video, native, connected TV, and mobile. The only difference with connected TV is that we're overlaying genres and networks instead of URLs to find out what is that patient population most indicative of, the strongest indexing genres and networks. So jumping to HCP, so we're not leveraging any MPI data for our audiences. So where we find we add the most value on the HCP side is leveraging those physicians not tied to an MBI number, or maybe looking for nursing recruitment, or even hospital staff, so some of those long-tail HCP strategies. And in this case, we're leveraging one of our ID-based audiences, leveraging that same technique of that opt-in search panel, identifying which keywords are most indicative, in this example, an oncologist, and using that to build the model. And the great thing about this model is that it can run with IDs now and then be expressed as a cookieless model in the future, or run in tandem now while cookies are starting to go away. A second application of HCP is taking, I hit the red button. I knew I was going to mess up the clicker. The pre-built audiences. So our pre-built audiences are all built upon 3 to 5 contextually relevant URLs indicative of that audience. So in this case, sticking with the oncology example, we identified pre-built. So those are composed of, say, medical journals. So just finding HCPs in a different way outside of, in content that's highly relevant to them. And then we're adding those with additional URLs to build a custom model which can be shipped to your DSP seat to activate now and again in the future as an expression of a cookieless model. So we have spent the past year plus really testing and learning custom patient targeting across a variety of healthcare KPIs. So I just want to share with you some of the successes that we've seen across different KPIs. So in this example, we worked with a client, an antipsychotic client, who was looking to had to drive an efficient cost per QR. So in this case, their goal was 150, and we drove a cost per qualified reach at 50 cents, which is 48% lower than other partners that we were competing with on the plan, some of which were ID-based partners. Another example was a client. This client came to us because they were having difficulty reaching their audience based on privacy laws, so reaching adults with ADHD and parents with children with ADHD, and they were finding limited scale with traditional ID-based audiences, so they came to us to drive incrementality to the campaign, and in this case, their goal was click-through rate, and as you can see here, we drove a click-through rate that was 47% higher than their benchmark, and we were really able to optimize that campaign within the first 2 weeks to drive success right from the start. Another example, switching gears to online video. In this case, We drove an efficient online video completion rate, beating their goal by 18%. Their goal was 60%. And this client was a chronic migraine treatment client. Again, all of these clients were leveraging a combination of those search keywords and ICD-10 codes. This last example was one of our first launches of custom patient targeting, only leveraging search keyword terms for rare disease. So I've heard contextual a lot today, and that could be the solution in the future. In this case, we were compared to contextual, and we showed that we drove incrementality to their contextual strategy. So we're not looking to replace contextual, we're just looking to drive incremental reach. We did that while also lowering their CPA by 84%. All right, hopefully I'm staying under 10 minutes. Last slide. So the 3 things that we want you to remember about custom patient targeting. It is the only ID list behavioral targeting solution for healthcare that leverages both search and ICD-10 codes. It really eliminates the need to navigate complex rules and regulations. And lastly, it efficiently reaches patients, so it reduces costs and ensures privacy with every single model. Thank you so much. I'm Michelle Lenzo. Grab me or anyone on my team if you want to learn more. Scan this QR code to get to our site to learn more about custom patient targeting. Thanks.
All right.